It gives me great pleasure to introduce our guest speaker for our Royal Ball Speaker series. It's a fellow Canadian, Heather Tulloch, who's actually visiting us in person today from Ottawa, though we're doing this remotely. I met Dr. Tulloch at a behavioral medicine conference last summer or last spring, and really excited that we made a connection and are creating more linkages between our groups. So Dr. Tulloch is the director of the Cardiovascular Health Psychology and Behavioral Medicine Laboratory at the University of Ottawa Heart Institute. And what's really exciting is that her group, as far as I understand it, is really integrated in not only doing research, but they actually provide psychological assessments and interventions for patients with cardiovascular disease at the Ottawa Heart Institute. And so I think, as the Center for Behavioral Cardiovascular Health and our Royal Ball Center more broadly, we can learn a lot about the model they have for, again, not just doing research, but also providing clinical services and really making the work they do be implemented into the care of the patients from their institution. She's also really well funded by the Canadian Institutes of Health Research. It's the NIH equivalent for Canada. She also has funding from the Heart and Stroke Foundation of Canada. And today she's going to tell us about some of her research, particularly related to couples-based interventions. She has a study called Healing Hearts Together. And I look forward to her presentation and discussion after the presentation. So welcome, Heather. Pass it on to you.
Thanks so much. And I feel guilty today. I didn't really realize that it was actually a day off for most people. In Canada, we, of course, observe the 11 o'clock, but after that, and even before that, you're at work. And so I appreciate those that are here, despite that, necessarily aren't expected to be. So as Ian mentioned, I am a psychologist at the Heart Institute in Ottawa, and I've been there for about 20 years. And I've, over the years, really started to appreciate over that time, my appreciation grew more and more about how important things are, not only for the patient, but also for those around them. Obviously their families, but also and especially their partners. And so I'm going to talk to you today a little bit about the work that we've been doing in the development of our Healing Hearts Together program. And so you'll sort of see our step-by-step process in developing that intervention, and I'll tell you where we're at to date. So I'll just get my slides going here. So I'll just talk a little bit about the importance of social relationships, talk a little bit about the mechanisms by which relationship quality impacts heart health, and then talk about some of the couples-based interventions that are out there already. And then, as I mentioned, the development of our program. But to start, and this is incredibly relevant, I think, through the last few years, social isolation is very important with heart health. And there was a meta-analysis that came out about 5-6 years ago now that showed that poor social relationships are associated with an increased risk of the development of coronary artery disease. And then another one that just came out in the last year that showed that low social contact is also associated with increased risk, so 59% increased risk of incident heart failure among men. And in fact, in some of the literature, I don't have a slide here, but I do some work with the Canadian Women's Heart Health Alliance. And certainly for women, social support and isolation is incredibly important for their heart health. And of course, that isn't only for the individual, right? The individual has some of these negative consequences, but our healthcare system as well. And so this is seen across multiple countries, not just, in Canada or the US. But with poor social relationships, there does tend to be increased healthcare utilization. So things like increased GP visits, ER visits, hospitalizations, readmissions, and then the length of stay does tend to increase. And let me tell you, I've seen that during COVID. It's been unbelievable when I work with inpatients. It just feels like there's more issues, and I've had way more consults for people trying to cope because their families aren't or haven't been able to be around them. On the positive side, then, there is some evidence to show that there is this positive link, though, between relationships and survival. So there was a meta-analysis, is sort of our one of our key studies that came out about 10 years ago, showing that there's a 50% greater likelihood of survival for participants that had strong relationship. And what's key is that this was consistent across age, sex, initial health status, and the cause of death. And the magnitude, and this is the part that I think is most important, the magnitude of this association was comparable to biomedical and behavioral risk factors. So, we often think about, hey, have you started exercising? Did you quit smoking? But we don't say, hey, how's your relationship? But yet it's really just as important. We talk about, just the fact of whether a person is married or not, so just their marital status. And that is important. There's some evidence that shows that certainly if just being married is associated with fewer cardiovascular risk factors and reduced mortality. Now, we will say, with my women's heart health hat on, I do wonder, I'd like to tease this apart a bit more for men and women. But certainly in the literature thus far, which includes about 75% typically male in many of the studies, this is the case. But the longitudinal study that I want to highlight looked at patients who'd had MI, and they compared those that were married to those that weren't. And you can see here the odds of dying were, the odds ratio is 1.7 for those that never married, 1.70 for divorced, and a little bit lower, but still there for those that were widowed. But as I mentioned, this is just marital status, and it's not just the presence of a relationship, but it's the quality that's important. And so what I'm talking about there, just to make sure that we're on the same page, relationship quality, or one that's high in quality, is where there's feelings of satisfaction with the couple relationship, positive attitudes towards their partner, feeling loved. And you notice that I have those in letters in caps, because you really have to feel it. You might know, oh, well, I know he loves me, or I know she loves me, but you want to feel that love and acceptance and feeling emotionally supported. And also having infrequent hostile or conflict in the relationship. So I'm not going to talk about all of the studies, because there are a number now, but I just want to highlight a few. We do know that there are studies that show that emotional support from husbands protects against metabolic syndrome among wives. And then probably my favorite study that I like to cite all the time is that patients, there's one where they followed patients for 15 years after having bypass surgery. And they found that those that were in satisfying relationships were over 3 times more likely to be alive that 15 years later than were those in the unsatisfying relationship. Now, I'm sure there's multiple pieces to that, but in many of these studies, they do factor out, the clinical variables, and age. And so there is really something to be said about this positive relationship quality. And then, of course, the flip side that I've already highlighted a little bit is that relationship strain has been linked to mortality over a 10-year period, even when controlling for those risk factors. So just to ask yourselves, what do you think? What % of patients with heart disease and their partners really report relationship distress? Is this even an issue? Like, do we have to worry about it, or are they all pretty happy? Who says, like, well, maybe you don't have your cameras on, but here, I'll tell you the answer. It's about 30%. Now, in one of the studies that we recently did, we found about 24% distress, and that was a cardiac rehab population, and they tend to be happier than the general cardiac population, I would say, and more motivated. But certainly, at least about 1/3 are, having relationship distress, which may be affecting their heart health. So some of this distress might come from long-standing marital problems. Certainly, there's stuff that may be going on from years past. I remember one couple that was in one of our groups who had been married for 42 years, and they were still talking about, sort of what one of the relationship experts would call a relationship injury from the first year of their marriage. So they could be longstanding, or it could be changes in the roles or responsibilities related to heart health. So I have a number of patients, actually one joked with me and said he used to always do the driving, and now she's doing the driving. And he said, well, that gets my blood pressure up. So clearly, there's changes in the roles. Certainly, there can be also distress due to different coping styles. So if someone is more an approach coper, meaning they want to get as much information as possible, as compared to maybe someone who's more an avoidant coper who just is like, nope. I had one patient I remember who told me, he said, I'm a person, I don't want to know anything. Just tell me where I need to be. Tell me what I need to bring. And that's all I want to know. Whereas the wife was very much interested in every little piece of information, and he would go to an appointment on his own, and then he would come back home, because this is during COVID, she was not able to accompany him, and she was asking multiple questions because she was anxious about it, and he was like, I don't know, because of course he was, had the earmuffs on and didn't hear anything. And so all that to say, if they're not coping the same way, that potentially can lead to relationship distress. There's two main ways that I'm going to highlight that relationship quality can affect heart health. And these are just some of the mechanisms that have looked at in literature. And this is newer information, but we're still learning. But there's direct links, which I call sort of more the physical links, and then indirect links, which are more the behavioral and emotional. So this is a little bit busy here, but essentially some of those direct pathways are how the relationship quality might affect the cardiovascular, neuroendocrine, or immune systems. So cardiovascular reactivity, which I'm sure everyone is aware of, when there's conflict or low warmth or high controlling interactions, that increases blood pressure. It also increases coronary calcification, both men and women. Certainly cortisol is another one that we see when there sort of is this pursue withdrawal, where one sort of comes at the one partner and either criticizes and the other one sort of pulls away and shuts down. That leads to higher cortisol secretions. Whereas the reverse, where there's, this coming together, that reduces cortisol secretions. And I think my favorite study was they showed that for every 1 unit increase in marital support, there was a 28% increase in heart rate variability. So, which is obviously very important and sometimes can be reduced, especially among, our heart failure patients, for example. Now, we also see that with rejection or hostility and some of the other conflict, that certainly inflammatory markers increase, and that's particularly among women. There's also slower wound healing in patients who experience hostility from their spouse. So all of this is important, obviously, because, chronic cardiovascular activity or inflammation can contribute to tissue damage and atherosclerosis, which we know obviously is not great for our population. On the other side, of course, the behavioral side, certainly, and I think we all know this when we have been stressed ourselves, or if we've been in a spat with our spouse or partner, we are maybe not always doing the best things for our bodies. And so we might smoke more, or, have another drink to take the edge off, or we might, grab something that's not as healthy eating wise, something sugary or high fat. And so that, of course, all these things are linked to heart health. And then the other piece that we often do see is that there is better compliance with medications, with attendance with cardiac rehab, when relationship quality is high. And we have seen, and there's a little bit of research here, and I can also speak anecdotally, that spouses really can influence health behaviors. So, I've many partners said, oh my gosh, she's making all these wonderful new low sodium meals. She's researched every recipe. Or, he is he's forcing me to go on the walk every night together. And also, of course, in assisting in management of their care. So attending appointments or managing medications. So you can see here how on, a physical level, there's, mechanisms that might influence our heart health, but also on a behavioral level. And then finally, on the emotional level, emotionally responsive partners lead to reduced negative affect. And we all know, of course, that mental health is linked. Positive mental health is better, of course, for heart health, but we also know that things like depression and anxiety is negative for our heart health. And so if the partner is there and to support them, then they're less likely to develop some of those mental health conditions, which are linked to heart health. The other thing is, if a partner knows or a patient knows that their partner is there to support them, then the way they think about things can be different. If they have a stressor coming at them, they go, okay, well, I know they are there to get my back. So then I feel more capable of coping. And so then they may not have that same sort of cardiovascular response to it. So it's seen as a lesser of a stressor. And so they can sort of look at it more with rose-colored glasses as opposed to real darkness. And these things can also contribute to better heart health. So this was nicely summarized in a paper that came out by Holt Lundstad. And actually, there was another one that just came out this year that, of course, Ian would know about because it was in the current cardiology reports by Tim Smith. It was a nice review as well. But it just talks about the summary of kind of what I've talked about. There's the social connection of things, there's lifestyle factors, there's psychological factors, those biomarkers, and then the sort of medication adherence and compliance, some of those behavioral factors, and how that all leads to morbidity and mortality. So all that to say, we've figured out, I think, that stress of relationship discord can be detrimental to cardiac health, but supportive couple relationships, lights have gone out on me. There we go. Supportive couple relationships actually might protect heart health. So that, and with others actually before us, those in the relationship scientists and cardiac psychology have said, maybe we need to have some more couples-based interventions, really to emphasize a number of these mechanisms and really tackle them so that we can improve heart health. And so there was a review that came out, it's about 8-9 years ago now, looking at all the couples interventions for patients with coronary artery disease. And there's only 7 studies, and there's only been 3 more since that time, actually. And the focus has really been on traditional risk factors. So helping them with diet or exercise, a little bit on, information about cardiac treatment, medications, for example, a little bit on stress management, but only one, and I'll say this in a moment more about the limitations, but only one actually addressed more the relationship. But of these that are more traditional, they saw some modest improvements in patients' sort of disease and treatment knowledge, which is good, their blood pressure and quality of life. But again, they're sort of missing a number of factors, and I'm just going to highlight some of those limitations. So one is that these studies are really outdated. So most of them are over 20 years old. Most of them have really small sample size. And I will say, recruiting couples is not the easiest thing to do. And I can talk about that later if that would be helpful to anyone. The other piece I will say is that the data collection tended to be only of the patient. So with the majority, they did not even ask the spouses anything. And I think that's a real, well, it's a missed opportunity, but also when you think about the shared lifestyle factors between typically, patients and their spouse or partner, certainly it's a missed opportunity to help them as well. Relationship quality was also rarely measured. So only in 10% of the studies did anyone measure relationship quality. And only one intervention, this is Share et al., and that came out in 2014, really looked at communication skills. And what they did was just a sort of an enhanced communication as part of a physical activity intervention. Now, I found the results interesting of this one is that the success, they were successful in increasing physical activity. However, it was not maintained for distressed couples. So couples that were happy continued to keep that higher level activity going after the intervention, but couples that were not happy did not. So that's the only one that looked at that relationship quality and how it impacts some of these interventions. So all this to say is my colleagues and I felt like, okay, we need to get some more targeted interventions here for relationship quality. So we use the ORBIT model. So I'm sure everyone here is aware of sort of the 4 phases of drug intervention or drug trials. So this is more of the behavioral or psychological phases of intervention development. And so certainly, excuse me, at the beginning here, we now know we have this, clinical question, will relationship quality or intervention at least help with improving heart health? And so we then wanted to refine this a little bit further. And so what we did was we did what we call our CARE study. This was a longitudinal cohort study where we looked at the mental health and quality of life of participants that were in cardiac rehab and their partners. We asked them just simply to complete some questionnaires before and after their cardiac rehab program, which was about a 3-month program. And they completed the hospital anxiety and depression scale, the heart qual, which is a quality of life measure. And there was a sort of a sister or companion questionnaire for cardiac spouses that we used that matches on. And then we did actor partners interdependence modeling. So it's a type of structural equation modeling, if you haven't used it before, that takes into account actor effects. So it's the partner on themselves or the patient, sorry, the partner on themselves or the patient on themselves, or partner effects being the patient onto the partner or the partner onto the patient, as you can see in this diagram here. So in this study, we had close to 200 couples. And as you can tell by their demographics here, it's essentially what we see in cardiac rehab, or at least at our center. So many males, fairly white area in Ottawa, Canada, fairly well educated. Ottawa's a government town, and many people are pretty well educated. And most people coming into cardiac rehab are coming in after having an MI. And our results are summarized in the Journal of Family Psychology. And Dr. Karen Bouchard, who is a postdoctoral fellow, wrote them up quite nicely. But here's the take home, is that patients who are depressed and that decreased in cardiac rehab had partners that had greater positive changes in their emotional quality of life. So surprise, surprise, in a sense, right? The patients who got a little bit better, well, that helped their partner as well. But I think more importantly, we saw that patients who had improved physical quality of life through their participation in cardiac rehab, this really helped partners' anxiety drop. And so this is key because we know that, at least from what patients tell us, is when there's partners' high anxiety, that's actually really difficult for the patient, and it causes them distress and it causes conflict within the relationship. So we did a second study, and this is all, again, just informing us of what needs to be done here. So this is a cross-sectional study that we look now at relationship quality and mental health. So we started mental health quality of life. Now we're looking relationship quality and mental health, again, with cardiac rehab participants. And they completed questionnaires at the beginning of cardiac rehab. So we didn't follow them over time. This one, it was just before they started any cardiac rehab. They completed the dyadic adjustment scale, which is sort of the gold standard for relationship quality, as well as a couple of measures of depression and anxiety. And then similarly did the APIM analyses as we had in the last study. Again, close to 200 couples. And I will say these two studies were pre-COVID, and we were able to recruit these couples in about 6 months. So, and I'll talk to you in a moment about that. Can you tell it's a theme? Anywho, we did get, again, fairly similar to what we typically see in our cardiac rehab population as far as demographics. In this one, we were a little smarter. We asked them how long they've been in a relationship. So a lot of them had been in their relationships for a long time. And what did we find? We saw that patients actually reported higher relationship quality, so they were happier in their relationships, more satisfied, and less anxious than their partners. So partners tend to be more anxious than did the actual patients, which I think we've seen in other literature before. Also, couples with high dyadic consensus, so they agreed on sort of important things in the relationship, as well as being more expressive of their affection. All of those individuals reported fewer mental health symptoms, but only when their partner also reported high consensus and affection. And then we also saw that low dyadic cohesion, so sort of the degree of closeness and shared activities, was associated with worse mental health. So what this is telling us essentially is if they're not in sync, then their mental health is impacted. So that led us to the next step in this phase one, which was me, I guess, really teaming up with a couple of my colleagues, Sue Johnson here, who is on the left, who is an internationally renowned couples therapist who just happens, luckily, to be in Ottawa, and my colleague and friend, Dr. Paul Greenman, who is a psychologist. Both are psychologists who does a lot of training with emotion focused therapy. And so I sort of being the cardiac person and them being really the couples individuals, we teamed up to really develop an intervention. But before we did that, we thought, of course, we had ideas. We thought we know what we should do, but we thought we better ask the patients and their partners, is this something they'd even want? And are they even struggling? Like, certainly anecdotally we're hearing this, but we need to know more. So we did a qualitative study that was published in BMJ Open. And it was focus groups with patients and their partners. And we, of course, did, audio recordings and transcribed them verbatim. And then we did content analyses. And these are just some of the example questions that we had. We would say something like, sometimes people say things or say that heart disease brings them closer together. Other times they just say it seems to create more problems on top of stressors that they already had. How has your experience been? Or what's the most difficult part of having heart disease or having a partner with heart disease? And then we ask them, how can we help you? What might help you and your significant other cope better? What have you found most helpful so far? And then would you even be interested in a couples-based intervention? And they ask them what it would look like. So we, as I mentioned, or you would have seen on the early screen, we had 16 couples, so 32 participants. Again, pretty similar to what we're seeing in our cardiac rehab population. And this is what they told us. So the themes that came out was that, yes, they are experiencing sort of this emotional disconnection. The cardiovascular disease is leading to more stress and irritability, and that's sort of kind of pushing them apart. And I think one of the things that I hear most about is overprotection. So a partner's fear tends to, obviously make them worried, and that makes them sort of drive and really push, and some will say nag their partners, like, are you going to eat that pizza? Or, you can't have another glass of wine. And they're just on them. Oh, you shouldn't be doing that. And so, and understandably, because it's coming from love, but it's not coming away across that way. Role changes that I talked about a little bit already in caregiver burden, adjustment to lifestyle changes. So, a number of people are not used to doing activity. They're not used to going for that evening walk or being careful about their salt intake. But they also talked about positive relationship changes and sort of new ways to show affection or care for one another. So this is just one example. You need to take your medication. You forgot. Do I need to remind you? And then, of course, he's saying, well, you're always on my back about this. I can handle this. And then, of course, she's like, well, your handling of things is what got you here in the first place. And this is a very common, this is taken from patients because we do hear this back and forth. And again, it's out of care, but it does cause issue in the relationship. This is another quote from patients that we worked with. She says, he says, I get heart palpitations and I lose it. I don't want to be left alone because I'm scared something might happen. And the partner says, well, that's a lot on me. It's more than a full-time job. I managed for the first 3 months and then realized I wasn't even breathing. So I got short-tempered, intense, and stressed. But on the positive side, they also noted things like, this incident opened up a door, a new relationship all of a sudden had new facets, new things that you find out about each other, strengths that you never realized about each other. And so it can be a tool that can be used to strengthen a weak relationship or reinforce one that's already strong. So that took us to the intervention piece. So basically, what did they want? And so they said, there were 3 different categories. One was they just need practical information, right? They need to know about what do we do post-discharge? Are there workshops on just general stress management, medications, healthy eating? And so at our center, we have a number of these things. And we have, if anyone's interested on our website, there's a number of patient workshops that anyone can attend. And then they wanted to have more opportunities to share with their peers. So opportunity to meet and sort of normalize some of their feelings and know that they're not alone. And then they also asked for relationship enhancement. So really to have assist in their relationship in light of the new stressor, right? Because we have many stressors in life, but now this is a life-threatening one. And so they want to build closer connections in light of that stressor. So one of them said, we have to slow down our conversations. I say something and he only listened to the first half, and the second half was the most important. Then he might get mad at me because I didn't do what he thought I said. Our daughter said we used to say we do everything in shorthand, and now we have to go back to longhand. I think communication is key, and sometimes you need that third party to get that communication going. So from that study, we knew that, okay, qualitative results are telling us that it is impacting them. Well, the heart disease is impacting their relationships, and they are open to couples-based intervention. And so we started to develop our Healing Hearts Together program, which was based on emotion-focused therapy. It is not therapy, though, I will say. It is more of a relationship enhancement and educational program. And well, I'll leave it at that for the moment. What we do is 8 2-hour sessions, and we purposely do it once a week for 8 weeks. There are some programs similar to this that, do sort of weekend retreats. But for patients with heart disease, and especially things like heart failure, it's just too much for them. And so 8 2-hour sessions, we have sort of a didactic component at the beginning, where we introduce a topic, and then we have a video. One of our kind couples from the Heart Institute, a patient and his partner, agreed to be recorded. And so we play that video. And then we also have some transcripts from a conversation with them that we sort of, the facilitators role play. Then in each session, we also break out into the dyad. So the couples go sort of in their own corner. So when we were doing it in person, they would kind of move off to different places in the room. And we would have them do a small exercise where they were discussing together a certain topic about relationship quality. And then they would come back and share that. And part of that was also, after listening to them saying, we really want to be able to share with others. And I've heard so many people saying, wow, it was great to hear, that we weren't alone in this, that so-and-so was also struggling, and this other couple in the group. So all that to say, we'd have that group discussion, and then we would give them some at-home exercises that they would do. And when I say exercise, I don't mean physical activity, although that's great if they were doing it together, but they had some structured tasks to do together. This is sort of what it looks like session by session as far as the content. So the first one is really an introduction, just understanding more about, love and heart disease and that connection. Then in the second one, and this was really listening to them from these focus groups, was having a chance for them to share with their own group. So we actually separated them. We put the patients in one room and the partners in another room. And we gave them the chance to just talk, like, what's been the most difficult thing for you? What are your fears? What are your concerns? How has it changed your relationship? And it was just sort of a chit chat, but a structured chit chat, but giving them the chance to connect with others. And then in the third one, sorry, I'll just take a sip of water. In the third session, we talk about looking more at any negative relationship patterns. So sort of what I talked about earlier. So if, a partner is nagging, for example, and then that causes the patient to shut down, how that plays out, and how it plays out not only related to cardiac, but maybe in other areas of the world. And then in session 4, we talk about maybe how some of our relationship histories might be playing out now. So for example, I've had, many patients say, well, my father died from a heart attack, and that's causing me anxiety. And now that, she's had one, now it's making me that much more scared. And that's why I'm on, her case all the time. Then in session 5, we really help them sort of talk to each other about their fears and frustrations, and really try and come together more as a couple. And then in session 6, really forgiving some of those times that, where they've been hurt. In really distressed relationships, you might hear, like, you hardly came, you didn't even come to see me at the hospital. Like, what happened there? And you don't hear that a lot, but certainly in the more distressed couples. Session 7 is more about sexual health and cardiac disease, and talking about things like effective medications. And then finally, in the last session, we review sort of the lessons learned and how they're going to continue over time. So that now, we're finished phase 1, we're moving into phase 2. which is the proof of concept study. So what we did here was we really want to assess the feasibility and the satisfaction with the Healing Hearts Together intervention, and to see if there were clinically significant impacts on relationship quality, mental health, and quality of life. So we had 39 couples in this phase. And we had them complete the dyadic adjustment scale, the HADS for depression and anxiety, the SF-36 for quality of life, and also a satisfaction questionnaire before and after each. Actually, the satisfaction was just after the Healing Hearts Together intervention. And they provided also some qualitative comments afterwards. We basically said to them, what did you like? What didn't you like? What would you remove? What would you take away? And it just helped us, refine the program. So this proof of concept study was published in Health Psychology. And what we found was, here's just a little bit about the patient characteristics to start. So we did find they're a little bit younger, those that participated, than those in our typical cardiac rehab. So you can see our typical cardiac rehab is sort of 63, I think was the mean. And these ones are about 5 years younger. And they do tend to be, though, in relationships for quite some time. And again, similar to our cardiac rehab, they do mainly have coronary artery disease and typically presentation with an MI. And over time, what we saw from pre-post of the 8-week intervention was that relationship quality increased, and it actually increased even a little bit more for partners. Depression decreased, about the same for patients and partners. Anxiety also decreased, and again, a little bit better for partners. And the quality of life increased. So this is the physical component score of the SF-36, and as well for the mental component score for the SF-36. So we saw clinically and statistically significant improvements over time for all these. So that told us, well, this is doing well, at least so far. And then we want to look, are they satisfied? And they actually rated a 4.7 out of 5, so pretty darn high, which I have to be honest, side note here. I just thought when I first started doing some of this work, I thought, oh my God, this is going to be fluffy. Like, what is this stuff we're doing? Like I'm pretty type A, as are most cardiac patients. And I thought, are they really going to want to do this relationship stuff? It was amazing to see actually how well they responded to it. Anyways, that said, they had excellent attendance, and they did provide some insights to improve the intervention, but pretty satisfied with what we had developed. So we see so far that we have this acceptability and feasibility and potential program effects. But what about, cardiovascular outcomes or in comparison to a control group? Because of course, this is just the proof of concept study. So this now, of course, we're going into phase 3. So what we want to do, and this is CIHR funded, as Ian mentioned. So we want to examine the efficacy, or what we're doing right now is looking at the efficacy of the Healing Hearts Together program on patient and partners' relationship quality, mental health, and quality of life. So that we've already seen in the proof of concept, but now, of course, comparing to the control group. But we're also adding a number of other variables. So we're looking at health behaviors. So things like exercise, alcohol intake, fruit and vegetable intake, so that we can see if this is, as a whole, if this relationship enhancement program is improving those health behaviors. We're also looking at a number of risk factors. So we're getting blood work, and we're looking at things like cholesterol levels. We're looking at blood pressure. We have cortisol. And we're also looking at MACE. So we're looking at major adverse cardiovascular events over time. And so we're tracking those with our Canadian, oh my God, the CIHI, Canadian Information Health, Canadian Institute of Health Information. There we go. And looking at the data over time to see if, in fact, a program like this is actually reducing major adverse cardiovascular events. And we're comparing this to usual care, of course. So the results are to come. I can tell you that I have peaked a little bit, only proof of concept, not in comparison. And we are seeing changes in, a little bit with blood pressure. I'm excited there. I haven't looked at the health behaviors yet. So we'll see what happens. So I'm going to stop there, but just saying that relationship quality seems to be certainly linked to heart health through these physiological, emotional, and behavioral mechanisms, and that these couples-based interventions are needed. So far, we're seeing some positive work with our Healing Hearts Together program, and hopefully more, but sort of a wait and see as we continue with the study. So thank you very much again for attending today. And I'll stop there, and I'm happy to take any questions.